Good evening. You are tuning in to AWANI Tonight with me, Farhana Sheikh. Decision on booster dose for COVID-19 vaccine yet to be finalised, says Khairi. And lawmakers should put aside political differences and work together to get us out of this pandemic. That's coming up. The International Monetary Fund has revised downwards the 2021 economic outlook for ASEAN 5 countries by 0.6% to 4.3%. This as the group consisting of Indonesia, Malaysia, the Philippines, Thailand and Vietnam face recent COVID-19 infection waves that are causing a drag on activity. In its recently released World Economic Outlook report, the IMF, however, revised upwards the ASEAN 5 countries' economic outlook for 2022 by 0.2% to 6.3%. Southeast Asia has become a global epicenter for the contagious Delta variant, forcing countries to impose travel bans and lockdown measures that are dragging on growth. The downgrade, which contrasted with an upward revision in the IMF's forecast for advanced nations, highlights the divergence emerging across countries on the pace of recovery from pandemic-induced strains. All expenditure and agreements for vaccine procurement for the National Immunization Programme will be presented to the Public Accounts Committee. Minister in charge of the programme, Khairi Jamaluddin, said this was to ensure transparency and openness as the implementation of the programme involved a huge allocation. Khairi said that all documents on vaccine procurement and details on NIP expenditure amounting to 5.8 billion ringgit have been presented to the PAC at proceedings held twice, with the first on January 5th and the second last Monday. Speaking in Parliament today, Khairi said that Malaysia has secured access to enough COVID vaccines to cover over 130% of the entire population, or 41.7 million people. The country, he said, received over 26 million doses of vaccines to date, with more expected to arrive in coming months. 23.88 million doses were from government procurement, while the rest were contributions from other countries. He also said that as of Monday, 20.1 million people have registered for the vaccine, equivalent to 61.7% of the population. Some 89.1% of 3.5 million senior citizens have been vaccinated. Meanwhile, some 1.2 million individuals aged below 18 in Malaysia have registered to get vaccinated. The government has begun talks with vaccine manufacturers on possibly procuring booster shots and gave its commitment that the public need not pay should a third jab be required. Khairi noted that countries are beginning to make reservations for additional doses ahead of next year, particularly in light of arguments on the possibility for a need for booster shots. However, Khairi said any decision on whether a third shot will be required in the country has yet to be finalised, as the government awaits recommendation from public health experts.
Berkenaan dengan keperluan sama ada kita perlu booster dose ataupun tidak. Perkara ini juga akan dibentangkan bukan hanya dari sudut keperluan booster dose berdasarkan kepada pengalaman di negara-negara lain, tetapi sama ada kita dapat memberi booster dose heterologous vaccination. Maksudnya kita memberi vaksin yang berbeza daripada vaksin asal yang kita terima. Ada beberapa negara yang sudah mengamalkan heterologous vaccination, contoh di Korea Selatan, di Germany, disebabkan gangguan kepada bekalan vaksin, mereka terpaksa mix vaccination mereka.
The Institute of Medical Research will present its findings on the feasibility of heterologous vaccinations or the use of different COVID-19 vaccine manufacturers for each dose to JKJAV next week. Khairi added that any recommendation on the need for another booster dose will also be known then. The emergence of the Delta variant and the presence of many asymptomatic individuals have resulted in a spike of COVID-19 cases in the Greater Klang Valley. Commander of GKV Special Task Force, Dato' Dr. Chong Chi Kiong, said despite the vaccination ramp-up, the number of daily new cases was still rising because the protection offered by the vaccine takes time to build. According to him, the vaccine effectiveness is best 2 weeks after the second dose. In addition, from the experience and data of nations with high vaccination rates, Dr. Chong said that infections can still occur due to the Delta variant, although hospitalization and severe infections are significantly reduced. In order to stem the pandemic in the GKV, Dr. Chong, who is also Deputy Director of Health for Public Health, said the GKV Special Task Force has put in place a number of strategic measures to optimize care services, reduce virus transmission and support the community and health staff. Some of the key initiatives are increasing the capacity of beds, ICU care, oxygen supply, manpower deployment and use of volunteers, as well as strengthening COVID-19 assessment centres by offering a virtual CAC for the asymptomatic and mildly symptomatic patients and enhanced home monitoring management. Dr. Chong added that they hope to offer more RTK-AG tests to health clinics and general practitioners via sales of Medical Device Authority-approved test kits to allow for wider testing. The Ministry of Domestic Trade and Consumer Affairs is in the final phase of making vaccination for all employees in the retail sector as one of the preconditions in order for companies to resume operations during the National Recovery Plan period. Its Minister, Datuk Seri Alexander Nantalinggi, said this was especially for economic activities that involve face-to-face contact and interaction. In a statement, he said that the retail distribution and services are among important economic sectors for the development of the country. Therefore, the ministry hopes that the vaccination to the workers in the retail sector can be expedited to enable the business to reopen and operate fully earlier under NRP. Bangi MP Ong Kian Meng proposed that lawmakers from both sides of the aisle to set aside their political differences and focus collectively on getting the country out of the pandemic. This can be done by the setting up of a COVID-19 moratorium agreement that further enforce cross-party cooperation. The agreement, Ong said in Parliament, would allow leaders to suggest and have a discussion on the direction out of the pandemic. He added that after 6 months or even a year, leaders can then gauge the country's position and decide if conditions allow for them to settle their differences at the 15th general election. Ong stressed the importance of working together as evident in his constituency where the cooperation between the federal and state government saw 11 new vaccination centres being opened. The Bangi MP then added that the idea of the moratorium agreement was his brainchild and not the views of his party or the Pakatan Harapan coalition. Day 3 of Parliament's special sitting saw the presentation of the National Immunization Programme. Tonight on Consider This, we asked our guests what questions remained unanswered. We'll take a short break. Stay with us. Welcome back. Sydney's lockdown has been extended by another month as COVID-19 cases continue to rise. Australia's largest city has been under stay-at-home orders since late June due to an outbreak of the Delta variant. New South Wales, of which Sydney is the capital, reported 177 new cases today, with 46 of those infectious in the community. State Premier Gladys Berejiklian said it was not possible for the city to exit lockdown on Friday as had been planned. She also announced further curbs on movement, including a 10-kilometre limit on essential shopping. Authorities say they cannot reopen until the transmission rate is back to near zero. The highly policed lockdown has fueled discontent among some in the community. Several thousands of people took to the streets in Sydney, Melbourne and other cities last weekend in what they call as freedom protests. Phuket has seen a rise in COVID-19 cases recently, risking suspension of the Phuket Sandbox initiative, which opens up the island to fully vaccinated travellers. In the first 2 days of this week alone, a total of 54 cases were recorded on the island. The Thai government had earlier set a threshold of 90 cases reported within a week before calling off the initiative. In a bid to salvage Phuket Sandbox, local authorities closed public schools and shopping malls and banned gatherings of more than 100 people from Tuesday to stem the virus from spreading further. Local media reported that the increase in cases has been attributed to the people entering the island to seek jobs since the island opened for business. The Phuket Sandbox accepts vaccinated tourists from low-risk COVID countries without any quarantine period. Since the program started on July 1st, officials said some 11,000 foreign travellers entered the island, out of which 26 fully vaccinated arrivals were tested positive for COVID-19. Olympic host city Tokyo reported 3,177 new COVID-19 cases, a daily record high for a second straight day, as a spike in infections puts pressure on hospitals. Tokyo is under its fourth state of emergency, which is to continue throughout the Games until just before the Paralympics start in late August. Experts have warned that the more contagious Delta variant could cause a surge during the event. The surge also spells trouble for Prime Minister Yoshihide Suga, whose support ratings are at their lowest ahead of a general election this year. In a media conference today, Economy Minister Yasutoshi Nishimura said governors of 3 prefectures near Tokyo will ask the government to declare states of emergency for their regions as early as Thursday. He also said cases were expected to rise in coming days as testing may have been delayed over holidays last week. Tokyo Olympics organizers meanwhile reported 60 new games-related COVID cases today. A total of 169 cases were recorded since July 1st, despite strict rules and frequent testing among athletes, staff and media. One of the biggest names in Tokyo Olympics, American gymnast Simone Biles, has withdrawn from the individual all-around competition at the Tokyo Olympics. The announcement came a day after the 4-time Olympic gold medalist shocked the world by pulling out of the team event and put a sharp focus on mental health at the Games. Regarded as the most successful US gymnast of all time, Biles sent shockwaves through the Games when she dropped out of the team competition on her opening vault after receiving a low mark. The 24-year-old had said the pressure of living up to expectations and her quest for a record gold medal haul had left her no choice but to drop out for her own mental health. USA Gymnastics said Biles would be evaluated to see if she can take part in individual apparatus competitions still ahead. Athletes such as Biles and tennis superstar Naomi Osaka have highlighted the immense pressures on them, raising questions whether athletes get enough support for mental health. Osaka, who lost in her Olympic singles event on Tuesday, said she had been suffering from depression for nearly 3 years. Following Biles' decision to drop out, the International Olympic Committee (IOC) announced that it is operating a helpline in 70 languages for athletes dealing with mental health issues. IOC spokesperson Mark Adams said mental health remained a big issue and said it was a matter that the organization had been working on for some time. The helpline is operating 24/7 and will be available up to 3 months after the end of the Games. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I am Fahana Sheh. We'll see you again.